All right. Hey, everyone out there, all you future IAS officers getting ready for the UPSC exams. Let's jump right in. Today, we're taking a deep dive into something you'll definitely need to know about: obesity in India.
It's interesting, how obesity in India, it's a lot more than just a health concern. I mean, you really have to consider the economics of it all, the social structure.
Oh, absolutely. And urban planning, too, right? I mean, this is a classic UPSC topic.
Yeah.
Multidimensional, complex. And did you catch Prime Minister Modi's Man Ki Baat address? He talked about needing to reduce oil consumption.
Oh, yeah, for sure.
And it wasn't just about health, was it? It was about this bigger problem of, well, obesity.
Exactly. And, the World Obesity Atlas, they're projecting over 10% of kids between 5 and 9 years old in India are going to be obese by 2030. That's a ticking time bomb. For healthcare, for India's future.
So let's start with some facts before we get into the whys and the hows. The National Family Health Survey, we call it NFHS, it's got some pretty clear data. Between 2015 and 2021, overweight or obese women, the percentage jumped from 20.6% to 24%.
Yeah. Big jumps.
And for men, up too, from 18.9% to 22.9%. That's in just a few years.
And if we dig a little deeper into that NFHS data, well, you start to see this rural-urban divide. Obesity rates much higher in urban areas. So lifestyle and socioeconomic factors got to play a part, right?
It's not as simple as, what people choose. It's about what's available, what they can afford, the environment they're living in. Something that really stood out to me was abdominal obesity.
Right.
There was a Lancet study in 2023, and it said 40% of women and 12% of men in India have abdominal obesity. Why is abdominal obesity such a big deal?
It's not just the weight. It's where the fat is. Abdominal obesity, measured around the waist, it's more dangerous. That fat, it's surrounding vital organs, higher risk of chronic diseases, heart disease, stroke, type 2 diabetes.
So it's not just about how much you weigh. It's about where the weight is. And this all ties into childhood obesity, which, like we said earlier, it's set to really, really increase in the coming years.
Definitely. And this isn't just a problem for the future, NFHS data. Overweight children under 5, it went up too. 2.1% in 2015 to 3.4% in 2021. Think of the pressure on the healthcare system.
Yeah, and on families too. I mean, it's tough to think about all those kids. Growing up with health challenges, what does it mean for India's economy in the long run? I mean, if you've got a big part of the population dealing with chronic diseases, how's that going to impact productivity, national development?
You're thinking like a policymaker. That's exactly the kind of connection you need to be making for your mains exam. And it's not just about the economic costs. There's a social cost, too. Think about, the psychosocial effects. Bullying, stigma, lower self-esteem. It can have a huge impact on a kid, development, their future.
It's so complex, isn't it? And the consequences are huge. We have to understand the causes. I mean, it's easy to point the finger at individual choices. Not enough willpower, bad eating habits, sitting around too much. Is it really that simple, though?
I mean, yeah, it's tempting to simplify it, but there's so much more going on. Individual choices are part of it. But there are systemic factors we can't ignore. One example is the shift towards unhealthy diets, especially in urban areas.
Right. It's like, I don't know, are we programmed to crave all that sugary stuff? And processed foods, there's ads for it everywhere. No wonder Prime Minister Modi is saying cut back on oil.
But it's even more complex than that. There's this paradox. Food insecurity, it actually can contribute to obesity.
Wait, how does that even work?
Yeah.
Food insecurity and obesity.
Think about it this way. Nutrient-rich foods, fruits, vegetables, lean proteins, all that good stuff, it can be expensive. Low-income households, they might not have access. So they rely on cheaper options. High in calories, but not so nutritious.
So it's not always about making, quote-unquote, the right choices. It's about having access to healthy food, being able to afford it. It's about social inequality.
Exactly. And then there's physical inactivity. The Lancet Global Health, they had a study. Almost half of all Indians, they don't get enough exercise. No exercise, unhealthy diets. It's a recipe for an obesity epidemic.
It's so easy to see how that happens, especially in cities. Green spaces are shrinking and walking around safely. Forget about it. More and more traffic. It's hard to fit in physical activity.
Exactly. Think about poorly lit streets, crime rates going up, no bike lanes, no safe sidewalks. It all discourages people from being active, especially in cities. It's like we're designing our cities to make people less active, and then we're surprised when they, gain weight.
It's like we're blaming people for not being active, but we're not giving them the right environment. It's like we're missing something important here. And then there's another piece to this puzzle. Air pollution?
Yeah, air pollution.
I never would have thought of that. What's
Yeah.
the connection there? Air pollution and obesity.
I know, it sounds strange, but there's more and more research showing that air pollution can lead to, well, to inflammation, metabolic disorders, which then increase the risk of obesity. The environment and our health, they're connected in ways we don't always think about.
Wow. So unhealthy food, lack of activity, air pollution, and all these social and economic factors, they're all contributing to this obesity problem. It's overwhelming. Where do you even begin to tackle a problem this big? I guess we'll have to dig deeper into that next time.
It's a real mess, isn't it? But that's what makes it so interesting, especially if you're thinking about policy. Speaking of which, are you keeping up with the Hindus reporting on all this? They've been doing a really good job connecting the dots. Obesity, public health, government initiatives.
Oh, yeah, for sure. The Hindu has been so helpful for my UPSC prep, I mean. Their coverage is great, and I'm starting to understand what the government's trying to do, like the National Clean Air Program, the NCPEP. You mentioned that before, right?
Yeah. The NCDAPI, that's a perfect example of how tackling air pollution can actually help with other health problems too, like obesity. Less pollution, less inflammation, and all those metabolic issues that can cause weight gain. Everyone wins.
It's all connected, right? So let's say, just for fun, that we're the policymakers now. What would you focus on first to deal with obesity in India?
That's a great question, and you know the UPSC examiners, they love questions like this. First things first, healthy diets. We have to make it easier for people to get nutritious food and make it affordable, especially for low-income families. Maybe expand programs that help people buy fruits and vegetables, things like that.
Make the healthy choice the easy choice.
Yeah,
So people are more likely to pick the nutrient-rich stuff.
exactly. And we have to do something about all the advertising for unhealthy food, especially the stuff aimed at kids. They're bombarded with ads for sugary drinks, junk food, all that. It's no wonder they're developing bad habits so young.
It's like we're setting them up to have health problems their whole lives.
Yeah.
So healthy diets are number one. What's next on the list?
Number 2, creating spaces where people can actually be active. Invest in safe sidewalks and bike lanes, more parks and green spaces. Encourage people to walk and bike instead of driving.
Yeah. Make it fun to move around. Design cities for people, not just cars. Make it safe and easy to walk and bike.
Exactly. And then, well, this is the big one. We have to deal with poverty and food insecurity. I mean, how can we expect people to worry about eating healthy if they can barely afford to eat at all?
You're right. That's a big one. We have to fix those systemic problems that keep people from being healthy.
Yeah.
We need everyone to have a chance to thrive, not just survive.
And that's where the UPSC comes in. You're all going to be policymakers one day. You can make a real difference. Create policies that make India healthier and fairer. Be the ones who finally tackle this problem.
It's a powerful reminder, for everyone out there studying for the UPSC. Obesity in India, it's not just a health issue. It affects everything, and there's no easy answer.
And don't forget about the Hindu. They're doing great reporting on this. It'll really help you understand what's going on.
Oh, for sure. The Hindu has been a lifesaver for me. All right, everyone. We want to hear from you. What are your thoughts on all this? What do we need to do to tackle obesity in India? What policies do you think would work best? Let us know in the comments. We really want to hear what you think. And don't forget to like and subscribe to the channel for more deep dives, all about the UPSC. We're here to help you ace those exams and become the leaders India needs.
Yeah. Leaders who understand the issues and who care about making things better. We want to give you the knowledge, the power to make a difference. So, keep studying hard for the UPSC and remember that obesity in India, it's complicated. We can't just focus on individual behavior. We have to think about, the social, the economic, the environmental factors.
And it's all connected.
Yeah.
We need to see the big picture. There's no magic bullet, no one solution that'll fix everything. We need policies that encourage healthy eating and more physical activity and create a fairer society, one where everyone has a chance to really thrive.
So what would you do if you were advising the government? I mean, what are your top 3 priorities? Remember everything we talked about today. The economic impact, the social side of it, and the health consequences. It's a tough question, but it's one you should be thinking about as you prepare to serve your country.
That's a good point. Well, that's all the time we have for today. Keep studying and stay curious. And remember, everything we talked about, it's all based on reporting from the Hindu. It's a great resource for staying up to date on current events.